Hi everyone and welcome to today's demonstration in essential infection prevention and control procedures. In this session, we will talk through the proper use of personal protective equipment, effective sanitation, and disinfection techniques, and the critical process of wrapping instruments for autoclaving. Each of these steps plays a vital role in preventing contamination, in ensuring safe sterilization and medical instruments. By following these IPAC protocols, we can maintain a clean, sterile environment and protect both patients and health workers from the spread of infection. Let's get started. First, we need to remove the ring, all the accessories, and then wet hands. Apply soap. Rub palm to palm. Right palm over the left dorsum, vice versa. Rotational method, vice versa. Rotational rubbing of fingertips to palms. Rinse your hands. Then after that, you have to dry your hands. And now I will demonstrate the proper technique for donning personal protective equipment. We have here the gloves, the mask, the goggles, the gown, and the head cap. Let's begin the donning process. First, you need to don the head cap. Ensure that it is fit snugly and does not hang loosely. And make sure it covers all your hair and ear. Next, we have to don the gown. Slide your arms into the sleeves, ensuring the gown completely covers your torso from the neck to knees. Tie the gown at the neck first, followed by the waist. Next, let's put on the mask. Demonstrate applying the mask, adjusting the nose piece for a snug fit, and performing a fit check for N95 respirator. Next, don eye protection, goggles, or face shield. Place goggles over the eyes and ensure a comfortable, secure fit. And finally, we will put on the gloves. By following these steps, you can ensure proper donning of PPE and minimize the risk of contamination. And here are the devices that needs for autoclaving. And in the next video, we will be walking through the essential steps for washing and soaking medical devices before sterilizing into autoclave. First, rinse the devices. Rinsing begins by rinsing the instruments with cold water. This removes visible blood, tissue, and other organic material. Avoid using hot water as it can cause proteins to stick the instruments, making cleaning more difficult. Next, clean instrument manually with brushes in warm water and detergent. Cleaning, prepare a basin of warm water mixed with a neutral pH detergent or enzymatic cleaner. Using a soft brush, scrub all surfaces, joints, and crevices of the instruments. Pay extra attention to the lumen instrument by using a brush specifically designed to clean their interior. Mechanical cleaning with an ultrasonic cleaner can also be used to dislodge debris from difficult areas. Rinse the instruments. After rinsing, soak the instruments with solution. Soaking the instrument will help loosen any remaining debris. Typically, 10 to 30 minutes recommended time. Next, dry the instruments with a lint-free cloth. Drying, use a lint-free cloth to dry the instruments manually or place them in a drying cabinet. It is important to remove all moisture as leftover water can interfere with the autoclave sterilization process. Next video will demonstrate the proper steps to safely remove personal protective equipment. First, removing the gloves. Start by pinching the outside of one glove at the wrist. Taking care not to touch the skin, slowly peel the glove away from your hand, turning it inside out. Next, remove the goggles. Next, removing of the glove. Remove first at the neck. gun away from your body, turning it inside out as you remove it. Fold or roll the gun inward, keeping the contaminated side inside, and dispose it in the appropriate waste bin. Next, removing the cup. Grasp the back of the cup and carefully lift it away from your head. Avoid touching your hair or the front of the cup, which may be contaminated. Dispose of the head cup in the appropriate waste bin. Next, removing the mask or respirator. For a mask with the ear loops, hold the loops and gently lift them away from your ears. Avoid contact with the front of the mask. Next, hand hygiene. After removing all PPE, perform all final hand hygiene. Step using alcohol-based hand sanitizer. In this next video, this is to demonstrate the correct method for preparing and wrapping instruments for autoclaving. Sterilizing the instruments is essential to maintaining infection control in any healthcare setting. Today, we'll show you how to properly prepare, open and wrap instruments to ensure they are sterilized effectively. To ensure thorough sterilization, it is important to open all hinges of instruments such as scissors or clamps so that the steam can reach every surface. Here we open the scissors, making sure the blades are spread apart. This step is critical to prevent any trapped microorganism. Place a small piece of sterile gauze around the sharp edges. This is not only to protect the wrapping material from punctures, but also helps preserve the sharpness of the instrument during the sterilization process. Arrange it accordingly. Place sterilization indicator strip on the top of the wrap package. Next, we begin wrapping. Take the first corner of the wrap and fold it over the instrument, ensuring that they are fully covered. The wrap should be snug, not too tight, allowing the steam to penetrate and circulate during autoclaving. Continue folding the other corners of the wrap sequentially, making sure the instruments remain securely in a place and fully enclosed. Keep each fold flat and neat, following this standard wrapping pattern, which makes it easy to open in a sterile environment. After the final fold, place a sterilization indicator strip on the surface of the wrapped instruments. This strip will change the color once the instruments have been properly sterilized in the autoclave, providing a visual confirmation the sterilization has occurred. Finally, apply sterilization tape around the package to keep the wrap secure. sure the tape is tight enough to hold the wrapping intact but not so tight that it tears when opening the package in a sterile film. Next, don't forget to put the label. Write the date, the instruments used for, and don't forget your initials. And now it's ready for autoclave. Open the autoclave door and carefully place the trays inside. Make sure not to touch the sides of the autoclave as this can cause burns or contamination. Now select the appropriate cycle based on the type of instruments being sterilized. Common setting includes the temperature, pressure, and the cycle type. For metal instrument, use the standard temperature of 121 degrees Celsius for 15 to 20 minutes. Thanks for watching.